Hey guys, Dr. Dave again here with another video from Mosaic Life Care. And today this video is going to talk about something that most people have because they spend some time sitting, and that's lower back pain. Lower back pain can impact at some point in a person's life 80% of the population. And I'm seeing it in younger and younger ages also. So this issue is something that everybody has some type of knowledge about. Lower back pain is often caused when the body's ability to cope and adapt under a load or a specific movement has been impacted. The most common experience, or the most common source of this, is something in the literature that the literature calls lower cross syndrome. Lower cross syndrome is a consequence that happens when a body is in a specific position for long periods of time and it stiffens up. The analogy to this is what happens when the arm is in a cast. You break your arm, the arm is in a cast, the joints around the break in the arm, the wrist and the elbow become stuck and stiff as the arm is healing when the cast is on for 6 or 7 weeks, depending upon how bad the break is. You've got atrophy of the muscles, you've got sticking together of the muscles, there's adhesion in the muscle tissues because of that immobilization. Well, guess what, guys? The consequence of sitting is precipitating and creating this epidemic of lower back pain, primarily because we spend so much time in one position, not unlike what happens to the arm in a cast. There's just no physical cast around the midsection that you see, but the body's immobilization, because of being in a sitting position, is still critically significant. And so what ends up happening is the hip flexors become short, called the psoas, or the iliopsoas complex. They become short because of the hip being at 90 degrees. The hamstrings become short, and as a consequence to that, the abdominal wall gets turned off, the glute max, the buttock muscles get turned off, we have flat butt syndrome occur, and then the quadriceps become weak. The back becomes stiff, the range of motion is impacted, inflammation goes up, and then when you begin to expose yourself to an experience that might be so small as bending over to pick up a pen or a piece of paper, all of a sudden there's an excessive amount of pain that's not consistent with that type of action. Guys, if that's happened to you, you need to protect it. That's what we do here at Mosaic. We examine it, examine for it, we're aware of it, we look for it, and most probably 90% of the patients that we see have this type of situation. It's correctable. We need your involvement in your own health care, but give us a call if you have lower back pain because we want to know whether or not this lower cross syndrome is involved. We'll see you in the next video.